Hello, my name is Jara and I'll be talking about Ticagrelor in patients with stable coronary disease and diabetes. Here is my social media. First, we have to talk about the definitions. What is coronary artery disease? Coronary artery disease is a narrowing or blockage of the coronary arteries, usually caused by atherosclerosis. Stable coronary artery disease refers to a reversible supply-demand mismatch related to ischemia, a history of myocardial infarction, or the presence of plaque documented by catheterization or computed tomography angiography. Patients are considered stable if they're asymptomatic or their symptoms are controlled by medications or revascularization.
For this new set of guidelines on stable angina for the diagnosis, it's very important. We have changed the table to calculate the pre-test probability of the patients to have stable angina on the basis of age, gender, and symptoms, type of symptoms. According to this probability, we can pick the test for the diagnosis, and we encourage the physicians to do stress imaging.
The two major novelties in these guidelines are firstly a completely different way to consider the diagnosis in terms of diagnostic strategies, but also in terms of entities, because now we distinguish with some new entities of stable CAD, including the patient without stenotic lesion or with spasm, for instance. And also for the treatment, strategies have been simplified with only two lines of treatments. First line treatments being the beta blockers and calcium channel blockers, and second line treatment being other anti-ischemic drugs. And in addition, you will have the drugs for event prevention like aspirin, statins, and ACE inhibitors in some subgroups of patients.
Clarify is a large international observational registry of patients with stable outpatients with coronary artery disease. It's more than 33,000 patients in 45 countries.
At the 3-year follow-up stage, Clarify investigators measured and compared the outcomes of stable CAD patients, whether they had no ischemia or angina, ischemia alone, angina alone, or angina and ischemia.
The first result which struck us is that the majority of patients have neither angina nor ischemia, approximately 60% of the patients. Patients who have an ischemia alone have no different outcomes. They have similar outcomes. However, patients who have angina, particularly if they have angina and ischemia, are the patients who are worse off. So it seems that the crucial feature is not so much having ischemia, but having anginal symptoms. That is associated with a worse outcome. So there's more to be seen in this area, but really, even if a patient is doing well, we should be very aggressive with secondary prevention measures, and angina symptoms are a very bad omen in patients with stable CAD.
Diabetes. Diabetes is a disease that occurs when your blood glucose, also called blood sugar, is too high. There's type 1 diabetes, type 2 diabetes, and gestational diabetes. Over time, high blood glucose leads to different problems.
Diabetes is a disease that occurs when the amount of glucose or blood sugar gets too high. This is glucose, the main source of our body's energy, which comes mostly from the food we eat. Normally, insulin, a hormone made by the pancreas, helps glucose from our food get into our cells to be used for energy. But what happens if we can't produce enough insulin, or we produce none at all? Let's take a look at the pancreas, where insulin is made. With type 1 diabetes, our body's immune system destroys the cells in our pancreas. This means our body can no longer make insulin, and we need to take it daily to live. In type 2 diabetes, either our body doesn't use insulin well, or the pancreas makes some insulin, but not enough to carry sufficient glucose into our cells. Either way, we need to make up the difference by taking insulin or other diabetes medications to control our blood sugar. With either type of diabetes, glucose levels in our blood can get too high, which can lead to health problems, including heart, kidney, nerve, and eye diseases. Though diabetes is serious, it can be managed so it's less likely to cause health problems. For people with diabetes, check your average blood glucose level with an A1C test to determine whether that level is within your target range to reduce health problems. We also need to take our prescribed diabetes medicines, make healthy food and activity choices, manage our blood pressure and cholesterol, and quit smoking to help us live healthier lives. To learn more about diabetes and how you can delay or prevent health problems, visit www.niddk.nih.gov or call 1.
Now, Ticagrelor. It's an oral, direct-acting, selective and reversible binding antagonist of P2Y12 receptors, which prevents ADP-mediated activation and aggregation of platelets dependent of P2Y12. Its generic is Brilinta.
Brilinta is a prescription medication used to prevent heart attacks and strokes in adults. Brilinta belongs to a group of drugs called antiplatelet medications, which help prevent platelets from forming clots that could lead to heart attacks and strokes. This medication comes in a tablet form and is usually taken twice a day, with or without food, along with a low dose of aspirin. Some of the common side effects of Brilinta may include bleeding and shortness of breath.
Now we have the applications in medicine. The utility of Ticagrelor in clinical settings is associated with high platelet activity, such as ACSs, PCI, and stent thrombosis. It's co-administered with AAS for the prevention of atherothrombotic events in AIDS with acute coronary syndromes or a history of myocardial infarction and high risk of developing an atherothrombotic event. It's used in combination with aspirin to lower the risk of having a stroke or serious heart problems. Diabetic patients with coronary heart disease have a very high risk of having ischemic cardiovascular events. Part of this risk is explained by an increase in platelet aggregability, and therefore exclusive aspirin treatment may not provide sufficient antithrombotic protection. That's why we use Ticagrelor.
Clopidogrel, prasugrel and ticagrelor help to stop the platelets in the blood from sticking together and forming a clot. Because of this, they're called antiplatelet medicines. They work in a slightly different way to aspirin, which is why they can be taken together. After a heart attack, you'll be usually started on one of these medicines together with aspirin. This combination of medicines is effective in helping to reduce the risk of a further heart attack. If you've had a stent put into one or more of your coronary arteries, these medicines will also stop clots forming on the stent. The choice of clopidogrel, prasugrel or ticagrelor will depend on the type of heart attack you've had and if you've had a stent inserted. This will also affect how long you need to take this medicine for. Always check this with your heart team if you are unsure. It is extremely important that you do not stop taking these medicines without advice from the heart team.
Now, the pros and cons. For the pros, we have that Ticagrelor is a faster and more potent P2Y12 inhibitor. The benefit of Ticagrelor is independent of the therapeutic strategy chosen, medical, invasive, or surgical. In selected patients with a history of myocardial infarction, beyond the first year of DAPT, a reduced dose of Ticagrelor seems to prevent atherothrombotic events. Pleiotropic effects may explain the results of the pivotal clinical trial and suggest a mortality benefit of the drug. Ticagrelor does not require biotransformation to be active. It has a significantly shorter delay of action.
In the PLATO trial, which stands for Platelet Inhibition and Patient Outcomes, patients assigned to Ticagrelor compared with clopidogrel and who underwent CABG surgery had significantly lower total and cardiovascular mortality. Now in JACC, there is more detail on the differences in specific causes of post-CABG deaths. In the 1,261 patients with CABG performed within 7 days after stopping study drug, reviewers blinded to treatment classified causes of death into subcategories of vascular and non-vascular and specifically identified bleeding or infection events that either caused or subsequently contributed to death. They found that numerically more deaths occurred in the clopidogrel versus the ticagrelor group related to myocardial infarction, heart failure, arrhythmia, or sudden death, and that there was more bleeding in the clopidogrel group, including hemorrhagic stroke. Clopidogrel was also associated with an excess of non-vascular deaths related to infection. Among factors directly causing or contributing to death, bleeding was more common in the clopidogrel group compared with the ticagrelor group. The take-home message here is that the mortality reduction with ticagrelor versus clopidogrel following CABG in the Plato trial was associated with fewer deaths from cardiovascular and bleeding complications. It sounds to me like ticagrelor may well be the drug of choice for patients after coronary artery bypass graft surgery. I'm Peter Block, and this is a CardioSource Heart Minute.
Now we have the cons. The discontinuation of Brilinta will increase the risk of myocardial infarction, stent thrombosis, and death. There's no information about how it affects pregnant women or those who are given lactancy. The drug has been associated with an elevation in uric acid and creatinine concentrations. Ticagrelor therapy was associated with an increase in ventricular pulses, and dyspnea has been associated with ticagrelor therapy. Now, focusing in Ecuador. The Plato study shows that treatment with ticagrelor compared with clopidogrel reduces the incidence of death from vascular causes, myocardial infarction or stroke in patients with acute coronary syndromes. The benefits of ticagrelor were obtained in patients with or without ST segment elevation, without increased rates of major bleeding, and were independent of the strategy followed in the treatment of ACS, invasive or conservative. This same benefit is transmitted to various clinical settings, including stable ischemic heart disease. It's also important because here in Ecuador, for diabetes, it's recommended the use of antiplatelets aggregates. Now, for conclusion, patients with stable coronary artery disease and type 2 diabetes who did not have a history of myocardial infarction or stroke, ticagrelor plus aspirin was associated with a lower incidence of ischemic events than placebo plus aspirin at the expense of a higher incidence of major bleeding, including intracranial hemorrhage. As a result, there was no significantly lower incidence of the exploratory composite outcome of efficacy and safety with ticagrelor than with placebo. Thank you.